guys, so I am going to kind of just give you a little more in-depth detail on the health disparity or health issues paper that you have due on week 7. Just to this is going to kind of build upon off of your windshield survey that you completed. So I wanted to kind of get a head start because I know some of you already turned in your windshield survey. So looking at the rubric for health disparity, of course, our first criteria for on the rubric is our APA and grammar format. Just remember that this is a maximum of 3 pages in length, just similar to your windshield survey. And not included is your title and reference page. Make sure that we're just using first and second level headings in the body of the paper. So that kind of is 15 points of your grades. So looking down at the content of the paper, what I want you to do for the introduction, and remember, we don't put introduction as a first level heading, you'll just put the title of your paper. And I kind of focus your title on, what is the main need that you're looking at? So are you looking at physical needs? Are you looking at the social needs? So just make it more specific in this paper. And in the windshield survey, we kind of looked at the community as a whole and tried to identify the needs of our community. So this one, we're going to really key on whatever we find is the most important need of our community, which you identified in your windshield survey. So for your introduction, I want you to provide an overview of the paper. Read pages 414 to 415 in your textbook. And then I want you to select a disparity that you feel is the most common or the most important one in your community. And this is going to be, it could be community, country, globally, or a need from your windshield survey. So you don't necessarily have to build off of your windshield survey, but you already kind of have that foundation laid, so it might be easier, a little bit less work that you have to look into if you did use that. But again, if you find that something's really you're more passionate about, that's completely fine. So I want you to discuss the information regarding the disparity you chose and provide facts and statistics regarding that disparity. So why is this important? How does this disparity affect your community or your community, country, or globally? And so look at those different effects. Say you decide you want to choose unemployment. Maybe that's a big issue in your area. So how does unemployment affect the local level, at the state, national, and global? And I also want you to include how healthcare financing is influenced. So for unemployment, how is that influenced? If there is a lot of people unemployed, obviously they're not going to be having health and medical insurance. So how does that play into healthcare financing and healthcare reimbursement? So looking at those aspects of it, even if you select tobacco or alcohol use, how does that affect financing? Some people may select the social needs. Maybe there's not a lot of areas for hangouts or areas for elderly adults to socialize. That definitely can affect healthcare financing too. If you think about it, studies show if patients are not as social, especially in the elderly population, that affects depression, anxiety. And think about the health needs for patients that have mental health issues. The services provided for that, medications provided for that. So I think any disparity you identify, it's going to somehow influence healthcare financing. So I want you to look at that. And make sure you include 2 professional references for your findings. Make sure these are within the last 5 years. That's what we mean professional. So they're peer-reviewed journal articles or some type of professional references. You can even use government statistics, CDC, Healthy People. Those are great resources as well. But make sure that your information is in the last 5 years. Part number 3, I want you to interview 2 community leaders regarding that disparity you have selected. And it may be different for every person. Again, maybe I've selected unemployment, so I maybe want to interview the mayor or some type of council person in my community. Maybe I'd want to interview the CNO at the hospital, or maybe a director of a unit. Maybe I want to interview the county health department, the nurse that runs that. So I just want you to select, based upon your disparity, 2 community people, leaders regarding that affects that area. Again, say you do smoking or tobacco use. You can always even interview high school principals, school nurses. Again, health department's a great resource for probably most of your disparities that you'll choose. And these are some questions I want you to ask them. What are their thoughts and opinions of that disparity that you have chose? What are their feelings regarding this? How do they feel that this affects the community or the state or the national and the global level? How do they feel healthcare is influenced? So again, if you choose unemployment again, how do they feel that is affecting healthcare? Even if you did interview the mayor or someone that's not really healthcare personnel, they still are going to have their thoughts and opinions of how that affects healthcare. They're still going to have some basic knowledge of that. And healthcare financing. So, in their opinion, how does that affect healthcare financing, or how does that affect maybe the financing of the community? So, I want you to make sure you realize that it's going to take a little bit of time to get in contact with these community leaders. You can even email them, you can talk to them on the phone, in person, whatever is their preference is completely fine. Just I want you to make sure that you have that contact with them, because it's good that we have these ideas, that we see these disparities, but it's good to talk to people that can be influenced, to bring these disparities to their attention. So that's kind of what we're gearing this to, is we've identified this need, so what can we do to help resolve this issue, and what is the needs assessment of the community, and getting community members involved. And the last one is I want you to examine how you could influence policy or advocate to create awareness about the disparity or bring about a change. This is another big one because, again, we've identified the need, we've talked to our community leaders and have got their feelings and their thoughts and opinions on this disparity. So my next step would be, well, how could I create this change? How could I bring awareness about this topic, about this health issue? And so that's 1 to 2 paragraphs. And I want you to really think about this last part, number 4, because our next paper that you have due is your health promotion paper. And that's kind of where you're going to take number 4 and really expand upon that. So I really want you to kind of really think about, could you create a tobacco campaign for unemployment? How could you do that? Could you maybe create a website that has jobs available, or maybe training for people that don't have a skill? So there's just all kinds of things. Be creative. Don't think about money per se. Whatever you think you could do to bring about that change. And again, you're going to build upon that in your next paper, in your health promotion paper, the last one for this, or the bigger one for this semester. And then for the last part will be your conclusion. I want you to know, how is this information applicable to you in your professional practice? So after you have looked into this health disparity, you have talked to these community leaders, how do you feel this could help change your practice or bring more awareness when you practice as a nurse? And then I want you to at least identify one program outcome that you felt that this assignment specifically helped you address. And again, your conclusion will be 1 paragraph. For your paper, so I'm looking at your headings. You definitely will have, remember, you'll have your title of the paper at the first, on the first page of your paper. Again, it's not a heading, it's just the title. And then you'll go into your introduction, but we do not include introduction as a heading. So making sure you understand that. Your next paragraph is going to, or your next, the first level heading that you'll have is, I want you to have that as your health disparity, okay? So whatever you choose, unemployment, or if you choose tobacco use, so make that as your first level heading. And then underneath that, you can put 2 second level headings. Put facts and statistics, and then the next one would be disparity effects. It could be your second level heading. Then your next first level heading would be interview with community leaders. And then you could break it down to your second level heading could be about 1 interview with the first person you've chose, and then another second level heading with the second person that you've chose, and addressing all of these issues. Your Next, first level heading could be, you could title it Influence Policy or Advocate for Unemployment, whatever your health disparity is and how you're going to implement it. So make sure you put another first level heading for number 4. And then number 5 is your last first level heading, and that will be conclusion. Remember, at the bottom here is some BSN, here's the program outcomes that we are meeting through this assignment. So you can pick one of those to expand upon in your conclusion.